Thank you. The next item of business is a statement by Tom Arthur on ensuring the right support for young people's neurodivergence, mental health and well-being. The Minister will take questions at the end of her statement, and so there should be no at the end of his statement. I'm getting confused here. And so there should be no interventions nor interruptions, and I call on Minister Tom Arthur. Up to 10 minutes, please.
Thank you, Presiding Officer, for the opportunity to update Parliament and the Scottish Government's work to improve access to the right support for young people's neurodivergence and mental health and well-being. I know people are waiting too long to get the support they need, and I want to be clear from the outset that we are committed to making improvements in these areas. Last week, the Royal College of Psychiatrists Scotland published their manifesto for next year's elections to this Parliament. In it, they noted a significant increase in people across all ages seeking support for their neurodivergence. They highlighted the importance of a needs-based, stepped care approach of support for neurodivergent people. This echoes our own thinking. While I recognise significant work is needed in this area, and I will go on to say more about our plans for this, I want to highlight the National Neurodevelopmental Specification for Children and Young People. Published in 2021, the specification sets out standards for all children's services to follow to ensure children and young people are able to access the support they need for their neurodivergence. The specification takes a needs-based approach to providing neurodevelopmental support. It is underpinned by principles of GIRFEC and intended to be delivered by all children's services partners through a multi-agency approach. So I welcome the recommendations from both the Royal College and the Child Heads of Psychology Services in this regard. This is what we are working towards through implementation of the neurodevelopmental specification. Since the specification's publication, the scale and pace of the increase in demand for neurodevelopmental support and services, and diagnosis in particular, has been unprecedented. This growing demand is placing significant pressure on services and making implementation of the specification challenging. We know children and families seeking support can be left worried or uncertain about what support is available to them and how to access it, fearing that without formal diagnosis they will be left stranded. I want to take this opportunity to reassure parents and carers who might be worried that this is not the case. I recognise that a formal diagnosis can be important to an individual's identity and understanding of themselves or their child. However, support should be provided on the basis of need, not diagnosis. This is particularly important for children and young people whose needs will change over time as they continue to grow and develop, or who have support needs but do not meet diagnostic criteria. I understand, though, that for ADHD, medication can be important for some, and that a diagnosis of ADHD is needed to access this. But non-pharmacological support can also be helpful and is recommended by NICE in the first instance. It is also important that children and families are able to choose whether medication is right for them. Presiding Officer, much of the conversation in this chamber around neurodivergence has been focused on diagnosis and treatment and the relationship between this and CAMHS. These conversations have included incorrect assertions that young people are being moved off waiting lists to meet the CAMHS waiting times target. I want to be crystal clear that this is categorically not the case. CAMHS is a specialist mental health service for children and young people experiencing significant mental health problems. Neurodivergence is not a mental health condition, and CAMHS is not the appropriate service for children seeking a neurodevelopmental diagnosis. The improvements in CAMHS waiting time have been the result of significant and sustained investment by this government into mental health services and through the hard work of our CAMHS workforce. I wish to put on record my gratitude to them for the work they do every day to support children and young people who have acute mental health needs. The 18 weeks CAMHS waiting time standard has been met for the second quarter in a row, with 91.6% of children and young people starting treatment within 18 weeks of referral. But we cannot be complacent. Performance still varies across health boards, and some children are waiting too long to receive the support they need. We continue to provide enhanced support to boards that are not on track to meet the standard, providing access to professional advice and ensuring they have robust improvement plans in place. We also know that early intervention and prevention is key to supporting good mental health. and that not all children seeking support will need a specialist service like CAMHS. In fact, the majority will find more suitable support in their local community, and we are providing support to local authorities to ensure this is quickly and easily accessible. Indeed, we have provided local authorities with over £65 million since 2020 to fund community-based mental health and wellbeing supports for children, young people and their families. They are available in every local authority area, and councils report that they were used by nearly 83,000 people between July and March 2024. This £15 million per year funding is continuing through the local government finance settlement from 25-26, alongside £16 million for school counselling. Presiding Officer, returning now to focus on neurodivergence. I want to acknowledge concerns raised by families and in this chamber about neurodevelopmental diagnostic waiting times. I recognise that this data is not nationally reported or published. Our primary focus, quite rightly I think, is on timely provision of appropriate support. However, I certainly recognise that further work is needed to improve the quality of data that we have on neurodevelopmental requirements and support. We will continue to work with our health boards and local authorities to improve our understanding of the quality of data available and how this can be used to improve support and services. Last year, we provided nearly £250,000 to fund a range of individual projects aimed at improving assessment and support for children and young people, including family support and testing of digital assessment tools. This built on a previous £1 million investment to fund 5 pilots that focused on various aspects of the National Neurodevelopmental Specification, including implementing GIRFEC and multi-agency working. In partnership with COSLA, we have undertaken a review of the implementation of the specification, which sought views from education authorities and health boards, young people and their families, clinicians and third sector partners, along with others. The review highlighted areas of challenge and further work to support children's services partners to implement the specification. A report setting out our findings has been published today, outlining the specific short, medium and long-term actions we will be taking forward. These include providing greater clarity on the roles and responsibilities of partners in delivering the specification, opportunities to promote training, sharing good practice, including in the use of new digital assessment tools, work on data availability and work to improve support to families. I would like to extend my thanks to everyone who contributed towards the review. I'm also pleased to announce that to support us in driving forward this important and vital work, we will be setting up a cross-sector task force chaired jointly by Fiona Davis, Chief Executive of NHS Highland, and Dr Lynn Vinnie, ADES ASN Network Chair and Edinburgh Council's Head of Education for Inclusion. I am further pleased to announce today that to support this work we will be providing £500,000 additional funding this year to deliver improvements to the support and services available to children, young people and families seeking support for their neurodivergence. This funding will be available across children's services partners, recognising the multi-agency and needs-based approach required. Further details will be set out in due course. I do not underestimate how much work is needed to ensure that neurodivergent young people are able to access the support they need when they need it. This will not happen overnight. It will require collaboration and a range of partners working together, including within government, for example between my officials and officials in the education and skills portfolio. Neurodivergence reflects the rich, varied and complex ways our brains work. Neurodivergent children and young people bring unique strengths, perspectives and ways of thinking that enrich all our communities. But I recognise that they can face significant barriers in education and daily life that often continue into adulthood when entering further or higher education and the workplace. These difficulties can be made even harder by the increased risk of mental health struggles which many neurodivergent individuals experience, alongside navigating a world not always built for them. We have made positive progress in ensuring children and young people are able to access support for their mental health and well-being, and we will continue to deliver further improvements. We are in the early stages of an improvement journey for neurodevelopmental support, and I look forward to further detailed conversation at the upcoming cross-party summit on neurodivergence. I wish to end today by emphasising this Government's continued commitment to ensuring that all children and young people growing up in Scotland receive the right support in the right place at the right time. Thank you.
Thank you, Minister. The Minister will now take questions On the issues raised in his statement, I intend to allow around 20 minutes for questions, after which time we will move on to the next item of business, and it would be helpful if those members who wish to ask a question were to press the request to speak buttons, and I call Brian Whittle.
Thank you, Deputy Presiding Officer. Can I thank the Minister for early sight of the statement? It's the first time I've been able to officially welcome him to his new post, and he takes it over at a really challenging time, as he's just alluded to. Deputy Presiding Officer, when we have such a massive increase in diagnosis over such a short period of time, it's obvious that something catastrophic has occurred. And I would put it to the Minister that the Scottish Government have not been entirely honest with the public and the families that have suffered on the waiting list. The gathering of data has not been transparent, and the Scottish Government have once again been cherry-picking and manipulating the data to fit their narrative. If neurodivergent conditions were never supposed to fall under CAMHS, why did the Scottish Government allow this to occur in the data in the first place and for such a length of time? In March 2024, the workforce census by the Royal College of Psychiatrists reported the number of general psychiatrists, including locum roles, has remained unchanged for a decade. According to an FOI data I obtained, only 32% of children were seen for an assessment within the recommended timescales by the National Autism Implementation Team. I understand not everyone will need or want a diagnosis, but with the increase in demand, what is the Scottish Government doing to ensure that there are staff to diagnose these conditions, to give children the access to support they need where support requires a diagnosis? And finally, for those that won't want a diagnosis, what is the Scottish Government doing to better support these children, providing them an outlet through community activity? Because in 23-24, the SNP pledged £55 million for NDC services, and in this year's budget did not include a dedicated funding.
Minister.
Let me thank Brian Whittle for his question. The first thing I want to say, and I don't think this is what he intended, I do not view the rise in visibility and demand as catastrophic. Neurodivergent people have always been with us, our friends, our family and communities, but they have more of a voice now and they're being heard, and we're working to provide the support that they require, and that is important. Now, what we have had is a significant increase in demand over the last 5 to 10 years, and consequently our systems have to respond to that. That is why we brought forward the specification. That is indeed why we brought forward the review of the specification, why we supported the pilot areas, those tests of change to learn. And that is why we're taking forward the work with the task force, with the additional funding in year that I've set out today to support our local partners, health boards and children's services partners, to ensure that the right support is available in the right place. That is absolutely vital. Now, on the specific question around data, I've already touched upon that in my statement. I recognise that we do not have a national data set that we can utilise currently with regards to waiting lists for neurodevelopmental diagnosis. So that is why we are committed to continuing to work with health boards and local authorities to assess and understand the data is available and its applicability to improving outcomes for young people and children in our communities. And with regards to the point with regards to the workforce, we have previously commissioned the National Autism Implementation Team and NHS Education for Scotland to provide professional learning and development to a range of practitioners across a range of levels to increase awareness across those levels as well. So I hope that, in response to Mr Whittle's questions, clarifies some points. Finally, with regards to the data on CAMHS, it is very clearly presented in the Public Health Scotland website, and I refute the points that he raises.
I call Paul Sweeney.
Deputy Presiding Officer, and can I also welcome the Minister to his new role on the government benches, and also thank him for early sight of his statement, though I was dismayed by one aspect of his statement in particular, that there were incorrect assertions that young people are being moved off waiting lists to meet the CAMHS waiting times target. I think many members across the Chamber will agree it's a matter of fact, not assertion. It's exactly what we're seeing across Scotland as children get moved off the CAMHS lists to different pathways with often indefinite waiting times. It struck me as a bit of Orwellian doublethink. And it's very easy to declare a job well done when the Minister is reducing the list, not by successfully getting children and young people the help they need where they need it, but instead by creating additional lists. We know that several health boards are now counting initial assessments as treatment. For a target to be useful, it must be permanent, measurable and rigorous. And the Government has proven that the CAMHS waiting times target does not fulfil any of those objectives. It is unethical and ultimately futile. There are now children waiting years for the treatment they so desperately need. So will the Minister agree with me that waiting times measured in years is simply not acceptable in this country, and accept to finally fulfilling the Scottish Government's promise of spending 1% of the National Health Service budget on CAMHS by the end of this Parliament, so we can get children and young people the support they actually need where they need it?
Minister.
Again, let me be crystal clear. This assertion, and it is an assertion, that individuals have been moved off the CAMHS waiting time list is incorrect. CAMHS waiting times is for people with significant mental health conditions. Now, certainly, if there are individuals who are co-presenting as both neurodivergent and have mental health conditions, they will be on that list. But CAMHS is not the appropriate pathway for a neurodevelopmental diagnosis, and so the CAMHS statistics reflect that, and they are accurate, and the data is transparently provided for on the Public Health Scotland website. And we have provided additional investment into mental health. Mental health spending will reach almost around £1.5 billion this year. In the last 5 years, direct spending from the Scottish Government has increased from approximately £117 million to £270 million. So we are working towards that, and we are very close, of course, to meeting the target for 10% of all mental health spending, 1% spending on CAMHS by the end of this parliamentary session. And as I've already indicated, I am preparing to engage with health boards to work in partnership and constructively to ensure that those targets are realised. I
call Stuart McMillan to be followed by Ross McCall.
Thank you, Presiding Officer. The Health and Social Care and Sport Committee has launched an inquiry into ADHD and autism pathways and support, which I warmly welcome, as many of my constituents have contacted me about the issue. However, this has led to constituents asking what this means for the Learning Disabilities, Autism and Neurodivergence Bill that the Scottish Government has committed to. So can the Minister provide an assurance that this legislation is still being worked on, and that this additional inquiry highlights how seriously the Parliament views improving the systems that are supported to help neurodivergent people of all ages to get the support that they need?
Minister.
Can I also welcome the Health, Social Care and Sports Committee inquiry, and I can assure Stuart McMillan that this Government's commitment to developing the LDAN bill has not changed. The proposed bill is important to many people across Scotland, and we are firmly committed to ensuring that the rights of people with learning disabilities and neurodivergent people are respected, protected and championed. We have made a clear commitment that the work continues to progress, and that the next steps will be for us to publish draft provisions with the benefit of the consultation evidence informing our refined proposals. We are currently progressing this work, and it is being informed by discussions with the 3 bill advisory panels with representation from people with lived experience, stakeholders and practitioners.
I call Ross McCall to be followed by Rona Mackay.
Thank you, Deputy Presiding Officer. I am glad to hear that the Government are accepting that people are waiting too long to get the support they need. Whilst the Minister highlights that support is not based on a diagnosis, this is not necessarily the case for too many children and young people with autism and other neurodivergent conditions. And I also note that the Minister's assertion that young people are not being moved off waiting lists to meet CAMHS targets. And the Minister can be as crystal clear as he likes, but we have freedom of information that makes that statement completely false. If the Minister has this proof, will he commit to publishing the data that supports the statement regarding neurodivergent and CAMHS waiting times?
Minister.
Data on CAMHS waiting times is transparently published by Public Health Scotland. On the point around data for neurodivergent waiting time, neurodivergent assessment waiting times, I already addressed that in the substance of my statement. We do not have a centralised national collection of data on that, but we are working with health boards and local authorities to identify which data is relevant and which data can be best deployed to support outcomes for people who use these services.
I call Rona Mackay to be followed by Daniel Johnson.
Thank you, Presiding Officer. At such an early stage, it is so important that children and young people receive all of the support they need to thrive in an educational setting, particularly when those children and young people have neurodivergence and mental health issues. Can the Minister set out the importance of education and health services working together, and outline how Government is investing in additional support for learning for these young people?
Minister.
We all want children and young people to receive the support needed to reach their full learning potential. Education authorities should identify, provide for and review the additional support needs of their pupils. I can ask health boards to support this. Spending on additional support for learning reached a record high of over £1 billion in 2023-24. We have prioritised additional investment of £29 million in the 25-26 budget to support the ASN workforce. We provide local authorities with £16 million per annum to ensure that all pupils aged 10 and above have access to counselling services. The Cabinet Secretary for Education and Skills is bringing together a cross-party roundtable with local government to discuss supporting additional support needs in our schools.
Daniel Johnson, to be followed by Evelyn Tweed.
As someone with ADHD and who takes medication on a daily basis, I have to take issue with some of the assertions in the statement. The Minister stated that non-pharmacological support can also be helpful and people may choose to take other forms of therapy. But the reverse of that is also true. That for many people like me, medication will make the biggest difference. But most importantly, how can you choose unless you have a diagnosis? You need that in place first. And he also misquotes the NICE guidance, because while it is true that the NICE guidance suggests that for children other forms of therapy should be pursued, it also states that if behavioural and/or attention problems persist with at least moderate impairment, the child or young person should be referred to secondary care, that is, a child psychiatrist or paediatrician. So you cannot partially quote the NICE guidance that way. So I ask this: if CAMHS isn't the right pathway for diagnosis, what is? When will that pathway be implemented? And will it require a co-occurring conditions? Because if it does, essentially the only option will be to access diagnosis privately, and that costs thousands of pounds that many families cannot afford.
Minister.
I thank Daniel Johnson for his question, and I recognise his bringing his expertise by experience to bear on an issue that he has championed in this Parliament. The point I'm making is that I recognise this explicitly in my statement. I recognise for ADHD a diagnosis can be transformational because it allows for that access to medication. I made that point. I was quoting the NICE guidance to highlight that other forms of support, non-pharmacological support, is also important as well, often as the first line, the first intervention. And the other key point I want to convey is that when someone is waiting for an assessment or diagnosis, that should not be a barrier to support. Just as absence of diagnosis should not be a barrier to support, either should be waiting for an assessment be a barrier to support. That is absolutely vital, and that is what is expected should be delivered by our joined-up services with local government and health boards. So that is what I want to see. That is what the national specification is aiming at. That is what the work that is going to be taken forward by the task force following this review is going to be seeking to deliver, and that's what we're going to be discussing when we have the cross-party summit later in the year. I call Evelyn Tweed to be followed by Mark Ruskell.
Thank you, Presiding Officer, and I welcome the Minister to his new post. The Scottish Government has been trying to make improvements to reducing CAMHS waiting times, but it's vital that we maintain momentum. Can the Minister say more about how health boards are being supported to improve performance and provide our young people with the support that they need?
Minister.
Presiding Officer, as I've said earlier on, despite the improvements that we have seen, we absolutely cannot be complacent, and I certainly want to acknowledge there is still a lot of work to do. So alongside provision within the record £16.2 billion settlement for health boards, we have also provided an additional £123.5 million recurring funding to support better outcomes across a range of mental health services, including CAMHS and neurodevelopmental services. We are committed to supporting all boards to meet the standard that 90% of children and young people referred to CAMHS start treatment within 18 weeks. And we're providing access to professional advice and support to those boards not on track to meet the standard, as well as ensuring that we have robust improvement plans in place and monitoring their implementation.
I call Mark Ruskell to be followed by Alex Cohamson.
Can I also welcome the Minister to his new post? And in his statement, he said, it's important that children and families are able to choose whether medication is right for them. But the reality is that that choice is being denied right now. NHS Tayside has said to my constituents that due to a lack of capacity to safely prescribe medication, even children with an ADHD diagnosis cannot access that potentially life-changing medication. Does the Minister think this is acceptable? And will he meet with me to discuss the issue?
Minister.
I want to be absolutely clear that I absolutely recognise the importance that is placed upon a diagnosis, and particularly with regards to access for medication for ADHD. I don't want there to be any dubiety in anything I have said this afternoon with regards to that. I do not think it is acceptable that anyone is having to wait an unduly long period of time to be assessed or diagnosed. That is what none of us want. And I recognise the specific points he raises around Tayside as well, and I will be happy to meet with the member to discuss further.
I call Alex Cole-Hamilton to be followed by Emma Roddick.
Thank you, Presiding Officer. I welcome to the Minister to his new place. Presiding Officer, neurodevelopmental care pathways are vitally important to the Liberal Democrats. That's why we used our only debating day this year to bring them to Parliament. That's because people shouldn't have to wait 7 years for diagnosis, to face life-qualifying exams without support. The Minister's statement is utterly silent on the issue of shared care, which we raised in that debate, which is around the fact that something that used to happen where families could get a private diagnosis and NHS prescription thereafter is no longer available in NHS Lothian. Doctors have ended that because of concerns about the credentials and safety of private diagnostics, but also because they fear that they would be overwhelmed. The Executive Medical Director of NHS Lothian has now written to several practices saying that this is a decision that she cannot support. There is an impasse between NHS Lothian and the GPs. Will the Scottish Government now bring together those two parties to agree a protocol for shared care that can be delivered safely with adequate resources to make sure that we can actually start getting people seen?
Minister.
Yeah, look, I thank Alex Cole-Hamilton for his question, and also let me put on record my gratitude to the Liberal Democrats for bringing forward that debate at the end of May. As you would imagine, I've been through the official report and considering carefully a number of the issues that raised. The one about shared care is one that has stood out for me in my 2 weeks in this particular post that I'm now honoured to hold. I'm not going to underplay the complexity of the issue and, of course, the absolute importance of the lead clinician in regards to any decision-making that takes place. But I very much recognise the iniquity that can be created where those who are unable to access an assessment or diagnosis through the NHS are turning private and then confronted with a situation where the two systems aren't joining up. I'm not going to play down the complexity of this, but it is something that I'm going to explore further, and I'm happy to engage directly with the member as well as part of the wider cross-party summit.
I call Emma Roddick to be followed by Miles Briggs.
Thank you, Presiding Officer. It's vital that children and young people have access to the right support and specialist care, and I have been glad to see steps forward in understanding of complex cases, intersectionality and comorbidities in neurodivergence. It can make a huge difference if a child's sent down the wrong treatment route due to misunderstandings. So can the Minister say any more about the Scottish Government's work to make sure that young people are accessing the right pathways and services to provide adequate support?
Minister.
Can I thank Emma Roddick for her question and just reiterate that I understand there has been some recent confusion about the relationships between CAMHS and neurodevelopmental support, and that has been causing concerns. And again reiterate that CAMHS is not the correct service for children seeking a diagnosis of neurodevelopmental conditions unless they have a coexisting mental health condition. A neurodevelopmental pathway can, of course, help ensure the right support is provided. This is intended to ensure that young people who need CAMHS support for their mental health receive it in a timely manner, and that specialist neurodevelopmental support is available whenever needed. The specific design of health services is for individual health boards to decide. Each will have their own arrangements. However, the approach should be multi-agency, and services should be designed to ensure that children receive appropriate and timely support for their individual needs.
I call Miles Briggs to be followed by Elena Whittam.
Thank you, Deputy Presiding Officer. I think in all my time in Parliament, I've never heard such a disconnected statement from a government minister from the reality which our constituents are facing, especially young people. And I do think the minister should reflect on that and potentially withdraw this statement after today, because there is no mention of young people transitioning into adult services either in his statement. So can I ask him two questions? How many young people are not starting treatment prior to transitioning to adult services? He's not mentioned that. And how many families, as Alex Cole-Hamilton raised, have been forced to now seek diagnosis and treatment in the private sector because of the failures of his government?
Minister.
Just let me say to Ms Briggs, I reject the accusation of disconnect, because I've been very clear that waits are too long. I've spoken about the individual experience of people, and I directly responded to Alex Cole-Hamilton, recognising the issues that he raised. Transitions is an absolutely important point, and it is something I'm looking forward to engaging further with members on. Key to this has to be a joined-up approach. That's what the national specification seeks to achieve, and that is why we are taking forward the work of the review via the task force to ensure that we have a more joined-up, connected, integrated, holistic, person-centred approach, absolutely consistent with the GIRFEC principles, and that is what we're working to achieve.
I call Elena Whittam to be followed by Monica Lennon.
Can the Minister clarify how regional inequalities are being addressed in rural and post-industrial communities, including former coalfields, to ensure equitable and timely access to support for neurodivergent young people, as my inbox is full of contacts from families experiencing huge difficulties in accessing the support they urgently require and are entitled to, as set out in the national specification.
Minister.
Can I thank Elaine Whitton for the question and recognising her championing of these issues in the Chamber. I recognise that young people in rural communities can experience particular challenges in relation to their mental health and well-being. So it is helpful that decisions around the provision of mental health and neurodivergent services, which are delivered through a mixture of NHS, local authority and third sector organisations, are a local responsibility that can take account of local needs. We have provided significant investment to health boards and local authorities to deliver appropriate supports. That funding is provided in a flexible way to ensure that funding can be put to use in a way that is consistent with the place and the nature of demands of a particular location and is specific to the needs of the communities.
I call Monica Lennon to be followed by Rachel Hamilton.
Thank you. I also welcome the Minister to his new role and agree with him that young people are waiting too long for support for their neurodivergence, like my 6-year-old constituent from Blantyre who's been waiting almost 4 years. For many children, young people and families affected by the issues that we're discussing today, the school holidays will be a challenging time. So what reassurance can the Minister give my constituents that this summer, if they need it, they will be able to access the right support for them in a way that's both accessible and affordable?
Minister.
Look, I thank Monica Lennon for raising this issue, and I appreciate the challenges that can be presented when school holidays occur. Of course, there are statutory responsibilities placed upon local authorities and other partners with regards to ensuring the correct provision of services. But the point she makes with regards to the length of waiting times that are taking place is one that I find unacceptable, and I am determined to build on the excellent work of my predecessor, Marie Todd, in driving forward improvement. That's why I've made this statement today. That's why we're bringing forward the additional investment. That's why this task force has been established. And it's why I look forward to working with colleagues when we meet later in the year for the cross-party summit.
I call Rachel Hamilton to be followed by Stephen Kerr.
Thank you, Deputy Presiding Officer. The statement recognises that early intervention is key. However, following the tragic death of my constituent 18-year-old Harris McDonnell and a subsequent fatal accident inquiry, Sheriff Patterson stated that Harris was placed in wholly inappropriate adult psychiatric ward of Huntley Burn, and Minister, 107 young people since 2007 as a result of an FOI have been placed in inappropriate adult care. There are just 3 facilities in Scotland, and this statement doesn't accept that there is an issue from the diagnosis through to appropriate mental health care for young people. Will the Minister react to that, please?
Minister.
Well, look, can I thank Rachel Hamilton for raising this matter at the summit. I've had engagement on it. I have read the FAI, and indeed I have engaged with the media on this particular matter. I was interviewed yesterday on it. It is a heartbreaking and tragic case, and one that should not have happened. And as I have said previously, it is a matter of deep regret, and I apologise, because what Harris experienced, no one should have to experience that. And it underscores the importance that in those occasions when there is a requirement for inpatient mental health treatment for children and young people, it has to be in an age-appropriate setting. Now, there is investment to increase the capacity of CAMHS. We have seen improvement. We also recognise that the overwhelming majority of CAMHS engagements takes place, broadly speaking, in a community setting. But the points that have been raised and previously have been reiterated by Rachel Hamilton about the number of young people who are not being seen in a dedicated adolescent setting are giving me cause for concern, and it will be a priority for me in terms of my engagement with health boards and other partners over the course of the summer to work through these issues. Part of that will as well be enhancing the capacity that we have within the system to support community settings for treatment and care, but I recognise the need for that inpatient capacity and the work that we have to do to make sure that all children and young people who are needing to be seen in an inpatient setting is a setting that is age appropriate.
And I call Stephen Kerr.
All respect to the new Minister, I cannot see how he can be crystal clear about anything when in his statement he concedes there's no national data. How do you make policy with no national data and publication of data? And another task force, what will this task force measurable outcomes be? And when will it report?
Minister.
Well, look, the point he makes about the need for data, I accept. That's why I referred specifically to, in terms of neurodevelopmental assessment. the need to have the ongoing work that we are doing, engaging with local authorities and health boards. The reason why we won't have that data is in terms of the statutory responsibility for delivering these services exists with local partners. That is where the services have been delivered. I made reference earlier to the fact that we're seeing a significant increase in demand. So the system has to respond to that. It has to be dynamic. It has to recognise that change. That's why I've set out the measures that I've set out today with regards to what we have previously stated with regards to the national specification, but having undertaken the review of that, the work needed to drive that forward so that the standards that are set out in the specification are being realised consistently on the ground across Scotland and, most importantly, are being felt in the lived experience of those who use the services. So I take the point with regards to the importance of data informing national policy. CAMHS, of course, is different, and what I sought to do today is to clarify what the CAMHS waiting times actually show, and I hope that has been of some use to the member.
Thank you, Minister. That concludes the statement. There will be a short pause before we move on to the next item of business to allow frontbench teams to change position should they so wish. Thank you.